Welcome to your OASIS training. We are so happy you have decided to join us as an OASIS companion. Today's training is brought to you by myself, Becky Hayes, your program coordinator,
Becky Doherty,
and Mackenzie Marie. Seniors in our community are feeling isolated now more than ever. The OASIS Companion Program was created to pair volunteers from the RSVP program to provide companionship and support to older adults experiencing feelings of loneliness or require extra assistance. The hope of this program is to create long-lasting friendships. Your support as an OASIS phone companion is deeply appreciated.
Thanks, Mackenzie. There are two options for the OASIS Companion Program. As a visiting companion, you would spend time with your client at their home, helping out with some housekeeping, meals, and medication reminders. Some days you may play games or just use the time to share stories and memories. On the other hand, telephone companions will typically chat with their client a couple times per week to provide friendship and support. These calls are also an opportunity to educate and connect the client to available resources.
This training you are embarking on will focus on your role as a phone companion. As a phone companion, you will be engaging in meaningful conversations, leading to a long-lasting friendship and a well check on a socially isolated older adult. As the program coordinator, I do ask that you make 2 calls per week, and of course the days and times will be coordinated between you, the companion, and your assigned client.
You are a valued volunteer at the New Hanover County Senior Resource Center. During phone conversations, you may recognize the client's need or desire for other programs we have to offer. As an OASIS phone companion, we encourage you to have a knowledge base about the other resources that could potentially benefit the client. Please share these with them and reach out to us with any questions you or the client may have. With that in mind, this leads us into the next slide. We would like to provide you with some background into the Senior Resource Center and why it's important to know what we offer to the community. In some cases, these programs won't apply to the OASIS client, but could help further down the road. Our mission at the SRC is to act as a focal point for aging services in New Hanover County by providing services which promote wellness, encourage independence, and enhance quality of life for all older persons. Below this, you will see a list of some of the services we offer, like home-delivered meals, transportation, and tax preparation. Now let's learn more about these programs.
The Senior Resource Center offers many services: options counseling and information and referral. With options counseling, social workers are working with an individual to facilitate informed decision-making about long-term services and support. With information and referral, social workers are informing individuals about programs and services and how to access them, identifying types of resources, providing referrals, and service coordination as needed.
The Special Needs Registry is an important resource offered through the New Hanover County Senior Resource Center. If you are on oxygen, have a physical disability that would make it difficult to evacuate, or have other special needs that would place you at higher risk during an emergency event, you are strongly encouraged to sign up for the Special Needs Registry as part of your emergency preparedness plan. Individuals who are on the registry will be contacted by a trained RSVP volunteer 36 to 72 hours before a hurricane or other known disaster is expected to hit our area. The volunteer will review your personal disaster plan and notify the Special Needs Task Force if additional assistance is needed. The Seniors Health Insurance Information Program, also known as SHIP, is a division of North Carolina Department of Insurance, which strives to assist Medicare beneficiaries in making well-informed health insurance choices. The New Hanover County Senior Resource Center SHIP volunteers offer free, unbiased health information on topics including Medicare supplement plans, Medicare Advantage options, Medicare prescription drug plans, Medicare summary notices, Medigap, and Medicare Patrol, prevention of billing errors, waste, or fraud and abuse. The Senior Resource Center also provides education and guidance on Medicare prescription drug plans and assists seniors who may be unable to afford medications by obtaining medications at no cost from pharmaceutical companies, subsidy programs, physician samples, and other resources. In the last year, more than 660 seniors were assisted by the Senior Resource Center through this program, helping them to save over $1 million on prescription costs. VITA, the Volunteer Income Tax Assistance Program, is a free tax preparation service by trained and IRS certified volunteers and is available to any New Hanover County resident.
Operation Fan Heat Relief, Fran's Fans, it allows one free fan per household of a person that is 60 years of age or older. The program begins in June and lasts until there are no more fans. Francis Weller from WECT goes to various Walmart locations and talks about the importance of the program, and people from the community buy a fan and donate it to the program. The Senior Resource Center also receives money each year from Duke Progress Energy to purchase fans for this program. Nutritional Supplement Program. The Senior Resource Center works with Kelly Medical with offering clients Ensure or Boost at a cheaper price than what is sold in stores. Incontinence products. The Senior Resource Center has partnered up with Lower Cape Fear Diaper Bank to provide clients with 2 free packages of incontinence supplies each month. The Senior Center offers notary services. The Senior Resource Center has 2 certified public notaries. The service is free. However, we do ask that an appointment is made to have your documents notarized. Medical transportation. Transportation service that will take clients to their medical appointments and back to their home 2 times per month. Nutrition education programs. We have an on-site nutritionist for clients to talk to concerning their nutrition needs and goals. The nutritionist does offer various education programs to include healthy cooking classes and diabetes education. Aloha, which is the library book and video program. The Home Delivered Meals program has partnered with the library to deliver materials to clients during the scheduled meal delivery. Options include paperback, hardcover, large print materials, audiobooks on CD and DVDs. And then we have the OASIS Companion Program, which provides companionship and support to older adults who require extra assistance and are socially isolated. The 2 components are the phone companion program and the in-home visiting companions.
RSVP, the Retired and Senior Volunteer Program, is a national grant-funded program designed for volunteers over the age of 55. This long-running program has many benefits, including training, tracking volunteer hours, recognition, and an open communication to ensure your volunteer experience is a good fit and rewarding. RSVP at the New Hanover County Senior Resource Center offers an impressive number of volunteer opportunities, including but not limited to OASIS, home delivered meals, kitchen assistance, Medicare counseling, and knitting or crocheting with our grads group. Our local RSVP also partners with nearly 25 community organizations offering volunteer opportunities ranging from gardening to retail help to restoration work and beyond. RSVP engages more than 500 volunteers here in New Hanover County. With a record number of community members requiring meals, our Home Delivered Meals program has 125 volunteers. The VITA tax program has 75 intake and tax preparer volunteers. We are constantly striving to connect senior residents in our community with volunteer services, and we encourage you to please spread the word that we are always looking to recruit new volunteers.
We would be remiss to not discuss the importance of cultural diversity in regard to the work we all do each day. And this also applies to our interactions with all of our clients, community members, and in conversations with phone clients. Our organization supports, values, and celebrates diversity, inclusion, equity, fairness, and respect. Just a few months ago, the New Hanover County Office of Diversity and Equity established a mission promoting an inclusive and fair work environment. Through the OASIS Companion Program, we will offer opportunities to embrace, support, and advocate for one another. Let's work together to build a community that values cultural differences and understands everyone for their own identity. Please keep these things in mind while interacting with your clients at the Senior Resource Center and in your personal lives.
We all have cultural biases, and sometimes it's important to step back and remember everyone has a different background. We want to meet the client where they are. It can be helpful to reflect ahead of time on potential differences. For example, in the blue text we listed religious beliefs and political beliefs. How would you respond in these particular situations? Would you be able to put the differences aside? It is important to develop deeper relationships with your phone clients, and this will most likely include similarities and differences. Embracing both of these between one another can create a great experience as an OASIS phone companion.
All information regarding your client and any private information that the client shares with you must be kept confidential. If you have heard something from your client that may require further assistance, do not hesitate to call us or email us. If you do call, make sure you are someplace where no one else is around. And if you send an email, please write confidential and secure in the subject line.
Here are just a couple of things to keep in mind as an OASIS companion. Always respect the spiritual and religious practices of your client and their family. It's a good idea to set boundaries. This may include keeping to a call schedule and establishing that you will call them. You never want to give a client advice on legal, medical, financial, or personal issues. Do not loan client money, and volunteers cannot accept gifts or cash.
When it comes to being absent or running late, we understand that things can pop up and we are all human. As a volunteer, we want you to treat any assignment as if you are working here. As soon as you know you won't be able to appear for the expected time on the phone, please call the client and notify them. It is important to understand the value of the client's time as well, and that they're looking forward to hearing from you and appreciate consistency.
There are steps that are going to be taken to match you and your client. Steps taken include hobbies, special interests, client requests, and individual characteristics. Oh no, what do you do if the match is not a good fit? Please contact your program coordinator.
There is a chance your client may be hard of hearing or easily distracted by background noises. Please take a minute to read over these suggestions to encourage ease of communication for the most productive phone calls.
Join me in taking a moment to relax and take a deep breath. The training has given you a lot of information so far, and you're doing great. It's okay and encouraged to go back and refer to this PowerPoint whenever necessary. Now here is a list of a few icebreaker topics to think about when learning about your phone client. It doesn't have to seem like an interview. Have a little fun. A conversation can be carried on based on any of these ideas. Use this as an opportunity to find things you may have in common and also ask questions when you have differences. Ask questions that are open-ended instead of yes and no answers. It's always fun to learn someone else's interest in music or where they've traveled.
Check out some other fun ways to get to know your client. When you're discussing your answers, it's always a good idea to ask why.
Volunteers are at the heart of what we do. Here are a few great quotes about volunteerism.
We can't help everyone, but everyone can help someone. Ronald Reagan.
Volunteers don't get paid, not because they're worthless, but because they're priceless. Sherry Anderson.
Volunteers are paid in six figures. SMILES. Gayla Lemaire.
We are now going to shift gears and talk a bit about disaster preparedness. Hopefully this is a good reminder for all of our volunteers in their personal lives. But again, as an ambassador of the New Hanover County Senior Resource Center and OASIS Companion, it is a great conversation to have with your client, as we always want to keep a close eye on their well-being. It is very reassuring to know that they have a plan in place in an emergency and that they are aware of community resources such as the Special Needs Registry. Here are some specific suggestions that could prove to be very useful in an emergency.
Please take time to review this hurricane checklist, and remember, don't wait until it's too late. It is amazing how many people are not aware of regulations regarding medications during an emergency. Most people are not aware that you can get extra medications even if they are not ready to be filled yet. Reach out to your local pharmacy for information as to which medications you can have filled early. Again, make sure you have a 7 to 10 day supply of medicines.
New Hanover County offers many resources to community members to help them prepare for emergencies. We encourage you to sign up for emergency alerts and to have a weather app at your fingertips if you don't already. Be aware of the options for shelters and evacuation routes and communicate applicable information to your OASIS client.
Believe it or not, abuse happens to older adults and often occurs from a caregiver or someone they trust. We are now going to go over some examples of elder abuse. Emotional abuse is when there is intimidation by yelling or making threats, embarrassing an older person, blaming them, ignoring them, or keeping them isolated from their friends, other family members, or church members. Sexual abuse is contact with an older person without their permission.
Elder neglect is another form of abuse when the client is not being cared for properly. An elder can experience financial exploitation. This is when various forms of the elder's personal information, like banking and identity information, are used by either a caregiver or outside scam artist. Another form is healthcare fraud abuse. This consists of unethical practices when a patient receives care by unethical doctors, nurses, or other providers, and being charged for care that was not provided. These are just a few forms of elder abuse. It's important to recognize when talking with your phone client.
Additional forms of elder abuse are self-neglect. This is when one has a lack of personal hygiene, not able to manage their own medications and/or finances, and may not be eating and drinking liquids as one should. If you think there may be a form of elder abuse, please call the social worker on coverage Monday through Friday, 8 to 5 at 910-798-6400. Or you can call Adult Protective Services at 910-798-3420 to make a report. They have someone there to take a report 7 days per week, 24 hours. All reports are confidential meaning the client will not know who made the report, and you will need to know the client's name, birthday, and address for the report. While getting to know your client, over time you may detect a change in their condition just by something that they have told you. For example, your client may tell you that they've been falling a lot. Some examples of changes in condition are changes in self-care, mental status, mobility, health conditions, or home environment. When in doubt, contact the social worker on coverage Monday through Friday, 8 to 5 at 910-798-6400.
Take a minute to write down these numbers for future reference. When you have a concern or a question regarding the phone client in your conversation, call the New Hanover County Senior Center's main line and ask to speak with the social worker on coverage. If it is an immediate emergency regarding the patient's well-being, call 911 or report to Adult Protective Services.
It is very important that we track and report your volunteer hours and the clients we serve. Becky Hayes will email or mail you blank timesheets. On the 5th of each month, please submit your hours for the previous month in 15-minute increments and round up when applicable. If you have any questions about tracking your time, please reach out to your OASIS program coordinator, Becky Hayes.
Yay, you've now completed the training. What do you do now? Contact me, Becky Hayes, via email or phone. After I assign you a client, please contact them within 24 hours. This will be a great time for introductions, breaking the ice, and setting up a schedule for future calls.
As we close out the training today, take a few minutes to pause the PowerPoint video by clicking anywhere on the screen or the pause button at the bottom of the video. Then click on the inspirational video link provided in the comment section below this video. After the inspirational video is finished, click on the blue back arrow at the top of your browser to come back to the training. So go ahead and pause the video now and click on the link. On behalf of the New Hanover County Senior Resource Center, thank you for stepping up to be a volunteer, and we will be contacting you soon with an initial assignment.
We love our volunteers.
Thank you.
Thank you.
Thank you.